I have a question for you. A 68-year-old man is brought to the emergency department after accidentally taking twice his prescribed dose of a muscarinic agonist. On examination, his heart rate is 38 beats per minute, blood pressure is 90/60, and electrocardiograph shows sinus bradycardia. So, activation of which muscarinic receptor is primarily responsible for these findings? You will learn the answer to this question after watching this video. Today, we will be talking about muscarinic receptors of the autonomic nervous system. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. Did you remember our roadmap? Yes, I'm talking about the acetylcholine receptor map. As you know from the last video, these are acetylcholine receptors. Today, we will focus on the muscarinic receptors of acetylcholine. Let's talk about the Muscarinic-1 receptor of the acetylcholine. Are you wondering how to remember the Muscarinic-1 receptor? It's very simple. Muscarinic-1 receptors are found in the brain. They are involved in cognition and memory. So let's remember. Muscarinic first, mind is first. They are also found in the stomach, where they contribute to gastric acid secretion. So let's remember. Muscarinic first, meal is first. So let's set up the equation then. Muscarinic-1 equals mind, meal. Then we will continue with Muscarinic-2 receptor. Similarly, this is also very easy to remember. Muscarinic-2 receptors are located in the heart and act to decrease heart rate and atrioventricular node conduction. Let's set up the equation then. Muscarinic-2 equals 2 atria of the heart. Next up, the Muscarinic-3 receptors. You will learn it very easily in a moment. Muscarinic-3 receptors are found in smooth muscles, exocrine glands, and the eye. They stimulate smooth muscle contraction, increase glandular secretion, and cause pupillary constriction. Let's set up the equation then. Muscarinic-3 equals 3S. Smooth muscle, secretions, small pupils. Meanwhile, muscarinic receptors are G-protein coupled receptors. Muscarinic-1 receptors are GQ coupled, Muscarinic-2 receptors are GI coupled, and Muscarinic-3 receptors are GQ coupled. We will learn how to remember all of these in later videos. Let's remember our question. Male patient brought to the emergency, accidentally taking twice a muscarinic agonist, heart rate is 38 beats per minute, blood pressure is 90/60, electrocardiograph shows sinus bradycardia. Activation of which muscarinic receptor is primarily responsible for these findings? The correct answer is the Muscarinic-2 receptor. Activation of Muscarinic-2 receptors, which are primarily located in the heart, leads to a decrease in heart rate and reduced cardiac output, subsequently lowering blood pressure. And that brings us to the end of today's topic. Now that you have mastered the core functions of muscarinic receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. Which class of drugs increases acetylcholine levels by inhibiting its breakdown, leading to increased stimulation of both muscarinic and nicotinic receptors? I will be waiting for your answers in the comments. See you later.